Okay, hey, it's Shilpa Bhoraskar here, and I've got with me Dr. Trupti Devrukkar on our call today. So, this is the deal. A couple of days ago, I just wrapped up one of the Argentum Live interactive sessions, and I was having this conversation with Trupti about the session. And Dr. Trupti has been my co mentor now in Argentum mentoring. And if you've been following this whole stages saga, since way back I wrote my first blog and started my mentoring program, then you would know that I was very clear that my Argentum students should get help from experts at each stage to help with their cases depending on the need. And it was then I invited Dr. Trupti as my stage 1 and 2 expert to help specific Argentum cases. Now, Trupti trained with me in medical school and went on to pursue a post graduation in homeopathic medicine. And now she runs the gynecology and obstetrics outpatient department in the hospital in Mumbai. So Trupti has been working with thousands of female patients at the hospital, and she's had incredible success using stage 1 and 2 tools in particular. And she offers a rich experience to unlock Argentum cases stuck at these stages. And we call Trupti our in-house encyclopedia of mother tinctures, and she's our go-to person for homeopathic specifics. And we try and meet over time when I visit India, and we converse almost every week. I would say, we share our ups and downs and cases over the years. And today we were just talking about the real key to success in using therapeutics and mother tinctures or any stage 1 and 2 unclassical approach. And students talk about not having enough success at these stages, and it's the classical approaches that have the most success rate. And and we were discussing that, and one idea emerged that you have to know the rules before you break them. So the idea is it's not about just getting in there and directly start your case taking using the tool that you know. It's not about getting in there and using your classical Hahnemannian way all the time, nor is it getting in there and using a mother tincture all the time. So it's about stepping back and understanding the real story and the different things that are happening in the patient's journey until he or she comes to us, and then where does he want to go. So it's about building up enough experience first to get started with conventional classical homeopathy, to trust your gut, to choose the best unconventional tool for your patient. So I want to actually look into and scratch Trupti's brain into what makes her so successful at stage 1 and 2, because she had this whole background in stage 3 Kentian homeopathy. She has a rich experience in being able to give a constitutional in 15 minutes, but she has also got this wonderful, she was talking about having a 60% of her patients actually need a mother tincture or actually need an organ remedy in her experience. So let's ask her as to what makes her so successful at stage 1 and 2, where most people struggle. So, Trupti, what can you talk about this? Can you share some experiences here? What is it that you know? What makes you successful at stage 1 and 2 here?
Hello Shilpa. Definitely, I would like to share a few points. The first thing that is, whenever you're going to use a mother tincture or a specific remedy, whether it is an organ remedy or a tissue salt, you have to be very sure about the sphere of action of that remedy. You have to know exactly where does it act and when to use this remedy. So once you are sure about the role of that remedy, it becomes easier to practice.
Correct. So that's interesting, Trupti, because what happens is it's so much simple also if you know your stages and knowing what stage your person's presenting layer is at, and you begin working on that. So you just never pick up any random mother tincture or an organ remedy just because a person has come up with that pathology and hoping it will work. So what so you were constantly tweaking your baseline homeopathic approach for every new client. Tell us about this. Tell me, how do you break the rules? When do you decide to break the rules? When do you decide to use a mother tincture or a stage 1 remedy?
Whenever a patient comes to us, he is going to present to us at any stage. It could be just the patient is talking at a higher level, a mental level, or the stage 4 stage. Or you may get patient who has just very common symptoms. So you have a wide range of patients coming to us, and you have to be very clear which what is the presentation of that patient. And once you know at which stage the patient is, it becomes easier to give the remedy. The constitutional approach is definitely there, but many a times I use the specifics and the mother tinctures or the supportive remedies, with what I call them, at stage 1 and 2. But we have to be sure, like suppose in case of fibroid, when a patient who is having a uterine fibroid comes to me, I will definitely give her a remedy which is going to directly work or act at the level of the fibroid. And this will be followed up by the constitutional remedy. The constitutional remedy will help in preventing the recurrence. But the specific remedy, like say example aurum muraticum nitricum, this aurum mn remedy in low potency will specially act at the specific level, that is the fibroid. And once this fibroid starts shrinking or the patient starts improving, you can always follow it up with the constitutional to prevent the recurrence.
So this is very interesting, Trupti, because most of us, when we have a case of fibroid, we directly start off with, taking, it is a chronic issue. It has a baseline miasmatic basis to it, and we would most of the practitioners would actually go in and take a normal Hahnemannian history and prescribe a constitutional. So this is where experience comes in. So tell me, with the pros and cons, when you've used just a constitutional and you use aurum, what is the difference in the way the case evolves?
Okay, now this is years back when I started using this remedy.
Yeah,
First, I used to always, as we were taught in school about the classical homeopathy, I would just go with that, give a single dose, wait and watch.
correct,
Now, the patient would definitely respond to it, but it was very time consuming, and
correct.
I was not very happy with the results.
Yeah,
Then, when I came across these remedies, the specific ones, I started using them, because here it is written in Boric, especially in italics, that this remedy has a very important action on the uterus and especially on these ossified fibroids, or when the fibroid undergoes changes, when it becomes hard. This remedy is said to act at that level, and it helps in reducing or in shrinking these fibroids.
correct,
So I started using this auromemin in low potency, where it is going to act at this root level, where it will act on the fibroids apart from the constitutional.
correct.
So, and I found that by using these specifics along with the constitutional, the cure or the improvement was much faster, it was less time consuming, and very satisfactory.
Perfect. All right. And have you had cases where you've just used stage 1 remedies and not followed up with constitutional? What was the difference?
Yes, definitely. Like for I had a few patients where I was treating them just on telephonic basis, like they would just call me up.
Yeah,
So it was very difficult to take the constitutional history.
correct,
But these patients were suffering from, example, fibroid only. So two of my patients had this fibroid, which was diagnosed on routine investigations. They were not having any complaints regarding it. So here I had just given them aurum mn as a specific remedy for the fibroids, and the patients definitely responded to it, because the size of the fibroid had decreased and they were asymptomatic. So naturally, it was I could not assess them depending on the symptoms, because they had no symptoms. But in the sonography, the size had definitely reduced.
Correct.
It had not gone back to the normal. I mean, there was from 4 centimeters, it had become 1 centimeter.
Correct.
And then for this last stage, I mean, for the total disappearance of the fibroid, this is a time when you need to give, or you need to boost it up with the constitutional remedy.
Perfect. All right. So that makes sense. So these larger fibroids, they need a specific to dissolve it to a level where then the constitutional or the baseline antimiasmatic remedy at that level can sort of kick in and get the person and resolve the whole situation. And this is something we learn in the organon and we learn in homeopathy school, but we were never actually taught this process of, give one remedy, an organ specific, and then go on and, work with the constitution. And I think this is just what clinics teach us. This is just what our patients teach us. And this is what, we keep talking about, is being able to tweak your baseline homeopathic approach to suit the needs of the client and to give them the best potential of homeopathy. So that was really good. Thank you so much, Trupti. So you see, the fundamentals are still the same. Sometimes a case may have so many layers of suppression through time, or that a new remedy may be needed every few months. But and there are other cases where you have one remedy which just dissolves this whole process because the pathology isn't that intense, it isn't that grave, or it isn't that deep enough for you to give a specific organ remedy that needs to first start the work and then complete it with the others. So Trupti, with the other things, even in our Gentum program, sometimes we see people lose their way. They use stage 1 as a shortcut, or they prescribe it at the wrong time for the wrong patient, and it does not work. So tell me about cases where the stage 1 actually does not work, or what are those sort of people where you've seen that this is not the right one for stage 1, even though it looks like a typical stage 1. Tell me about those cases.
Now, for example, when you have a patient who is coming with a, say, a history of repeated abortions,
Correct.
okay, where she is being having a bad obstetric history, and this patient needs homeopathic treatment.
Yeah.
Now, here, maybe her symptoms of abortion are gives you a clear cut picture of Sabina.
Yeah.
Okay,
Okay.
but because now this is a very deep seated miasmatic condition, here if you give just Sabina, okay, it's not going to prevent her abortions. You have to you will get failure just by using Sabina.
Mm-hmm.
this these are cases where you may need a deep acting constitutional anti-miasmatic remedy which will prevent her tendency for the abortion.
Yeah.
Sabina may come up just as a specific for her acute complaints, like she's having the bleeding and pain. For that, maybe the Sabina is coming very close to it, but it may not help because the ailments from, or there is a deep seated cause for that.
Correct.
So these are the patients where you may think of giving a deep seated constitutional remedy rather than giving any mother tincture or a specific remedy.
To start with. Okay. So you see, the fundamentals are still the same, and it's like you should know, and this is something only experience teaches you, as to when you use an intercurrent, when you use a specific, when you foresee that the mother tincture will boost up the case, and when you see it will interfere and really not work that well. So, the central core of the case and the journey and the direction of the cure is something that is cut in stone. And no matter you do it with one remedy or with 20 remedies, you need to understand the fundamentals and the direction of cure. Talk about that, Trupti. How do you keep track of where the case is going to? How do you know that the case is heading off in the right direction in spite of the mother tinctures and the intercurrents and the organ remedies and your constitutionals?
Yes, Shilpa, the basic thing is about the Hering's law of cure.
Yeah.
Hering's law of cure, this is the most important thing which will tell us whether the patient is progressing in the right direction or no.
Yeah.
We all know the Hering's law that first the symptoms, they are going to travel from more important organs to the less important organs in the reverse way when we are curing it.
Correct.
Okay, so these are, so you will be watching those symptoms. The suppose a patient has 10 symptoms or 10 complaints, and you are treating them, you are treating the patient with constitutional, you are giving a specific remedy also, you are giving some biochemic remedies also, and now you want to judge whether the patient is improving or no.
Correct.
So you are going to look at all his symptoms. If the patient is showing improvement in the most important symptoms, like say he has a cardiac pathology, and now this patient is showing improvement in his blood pressure, his cardiac complaints are better, and maybe his migraine has worsened, or maybe his skin complaints has worsened, but then you know that you are heading in the right direction, because now the cure is like from more important organs, now the symptoms have shifted to the less important organs, the skin.
Yeah.
So here this will help you in judging whether the patient is improving or no.
Perfect. So it is all also about knowing the power of when to change a prescription, the power of knowing the secondary prescription. If you keep repeating the same remedy forever, and if it does not work, even if it does not work, and hoping it will do something in some way, is basically not going to get you anywhere. So tell me about this as well, Trupti. When you are changing prescriptions, when you're moving on from one remedy to the other, is there a process that you go through? Is that something, when you have given, say, Auromurinat for that patient with thyroid, what stage do you know that now is the time to work and use another remedy?
Now, when a patient of fibroid has been referred to me and I'm treating the patient, uh, I most of the time start the case with aurum muret MN, okay,
Correct.
as a in low potency as a specific remedy. I may have two categories of patient: a patient who is showing some improvement with aurum MN, and a patient who is not at all responding to aurum MN.
Correct.
He is SQ or same. So now, when a patient is not responding to MN, here you are going to assess it again, and maybe the patient requires a a push somewhere where you may have to give him an anti-miasmatic remedy, and then you may repeat the aurum MN and see the action.
Perfect.
And in a patient who is responding to aurum MN,
Yeah.
in those patients, aurum MN is going to decrease the size of the fibroid. There is going to be some symptomatic relief, but for 100% relief or for 80% relief of symptoms, you have to give your constitutional remedy.
Correct. So at some point, that is how you know, that is how you assess, that is how you keep track of what's happening, what is currently going on, and what is your next step. So you have that whole sequence of things and the direction in your mind so you can make the right changes. It's not just about knowing Auromurinat works for fibroid. It is also about knowing at what point, in what way, and how long, and when to stop and when to give the next prescription. Is that right?
Yes, Shilpa.
Perfect. Thank you so much, Trupti. I think this was great. This was the point I actually wanted to make in this particular blog. Is it's not like conventional medicine. It's not like knowing these are my 20 remedies for helping these 20 conditions, because that's not the way homeopathy works or any holistic medicine works. It is about knowing those tools in your process, those tools, and picking them up at the right time and moving your case forward and knowing what your end goal is in mind. And that is what a real homeopathic, holistic practitioner knows and understands. It's not about an allopath coming in and knowing 20 remedies and trying them out and haphazardly making random prescriptions at his will. It is about knowing that whole holistic process, and the fundamentals have got to be very, very strong. I would say a stage one practitioner is only successful if they are absolutely strong at stage three and the fundamentals are really on track. So that is all that I needed to actually talk about. And if you have any questions on this, Trupti would be happy to you know get in and answer some of the questions that you have below this blog. But I just thought it would be interesting to have her. I was on a call with her and I thought she would be a great asset for this blog because she she has absolutely done wonderful work for so many cases in Argentum, and she knows that in and out the stage one approach. So thank you once again, and thanks Trupti for joining us. And
My pleasure, Shilpa.
okay,
It's
all
been
right
wonderful
then.
talking to you.
Absolutely. So I look forward to your comments and your suggestions and your feedback and any questions you have using stage one and two homeopathy under this blog, and knowing when to break the rules and when you do not break the rules. Tell me about breaking rules in homeopathy today. Take care.